In Fox 5 Health News, the FDA wants stronger warning labels on some popular pain relievers. The agency says there's an increased risk of heart attack and stroke in people taking these meds, even for a short period of time.
All right, joining us now, Dr. Doris Day, Clinical Associate Professor at NYU Medical Center. Dr. Day, thanks for being here. First off, tell us what we're talking about when we say NSAIDs and what the new warning sort of relates to.
So NSAID stands for non-steroidal anti-inflammatory drug. And there's two different categories of these. Aspirin is in one category, and this does not apply to aspirin. The other category would be things like Aleve, Motrin, Advil. And that's where it applies. And what the FDA is doing is they're just strengthening their warnings. Nothing has really changed, so you don't have to call your doctor in a panic, but do pay attention. So what they say is that if you're taking these NSAIDs, not the aspirin version, the other ones, you may have an increased risk of heart attack or stroke. And all you have to do is just be aware. And it's not always by length of time or dose. It can be even early on at any dose. The longer you're on it, the increase the risk that's there. So what you do is don't take a medicine you don't need, but don't suffer unnecessarily either. Speak to your doctor.
Do you think we're probably
and see
too
what the best
cavalier
balance
with
is.
our use of drugs like this?
Some people can be. So there's no need to suffer in pain and put up with it because you're afraid to take a medicine that you really do need, but just don't take it for the sake of it because you're afraid of having pain.
That's a
So
great
it's
way
just
of putting
having
it.
that good
Yeah,
balance. And also know the risks and the signs of a stroke or a heart attack. And if you're having those symptoms, crushing chest pain, pain going down your left arm, change in speech or mental status, know those signs and symptoms and call your doctor, tell a loved one, make sure you get help if you're having those symptoms.
Good deal. All right, how about this? The new cosmetic drug to get rid of double chins has guys lining up for treatment. One man had a plastic surgeon.
About something, right?
Well, you know, I think this is actually, like, this makes sense to me. One man had a plastic surgeon says 40% of his patients are getting the procedure are men.
Yeah.
And this is something that does sort of hit men hard down here. So, and there's been no really great way to do anything about it.
This is true. Men tend to be more averse to surgery, so they're looking for non-surgical options where they don't have scars or cutting in the skin. And we finally have a new product that's FDA approved for men to reduce that turkey neck, the fat under well, turkey neck is really more loose skin, but it's really for submental fat. It takes 2 to 4 treatment, and this is based on an ingredient that's naturally found in the body that metabolizes fat, and it's now obviously expanded and modified to be used as an injectable under the chin to melt the fat. You inject it right into the fat. It takes 2 to 4 treatments. You can have a little bit of swelling afterwards, but the good news is that the fat is permanently gone and it won't come back. So this is a really nice treatment to get rid of the fat under the chin, and it's great for both women and men, but I see this as a problem even more in men than in women.
Absolutely. Now, you don't have any weird side effects like fat starts growing on your knee or something afterwards, does it?
Else.
This tends to be not even weight related in many people. It's often just genetic. So when you reduce it in that area, it kind of helps the contour. And you want the neck to be at a 90-degree angle, not to be too under and not to be sticking down. So
it is amazing how much of a drastic difference that makes, especially in somebody's profile. It makes you look, you know, 10 years younger.
That's true. And it's sometimes in relatively young people as well. This is not something that just happens as you get older. I see 30-year-olds with too much fat under their chin, and a little bit of this product can go a very long way. And one thing we're noticing that's very nice is as we're getting rid of the fat, the skin does tighten a little bit too. So we have other treatments that can tighten the skin if there's anything left that's loose skin afterwards, but we do see a little bit of tightening. So in 2 to 4 treatments, permanent reduction of fat in this area, I think it's going to be a blockbuster.
How much for you to jab that needle into my gut right about here, off the records? How long till that treatment's on the way?
Well, that'll be a little bit of time. We have other things for there too, so there's lots in the pipeline. But meanwhile, nothing like diet and exercise. Okay, no shortcuts.
Boo, that's hard though. We don't like doing that stuff.
All right,
that's hard. All right, Nick, let's talk about